Hi, it's Dr. Mabourakh from Folsom Plastic Surgery. But I hope that was fun watching, but I wanted to talk a little bit about otoplasty. That's what we do to correct protruding ears. It's a very common problem. It used to be that we treated these in kids as they're going through school. Young kids, they tend to get teased a lot in school. And when they become aware of this is when we usually correct protruding ears. But that has changed. Now we're doing mostly on adults. It's a very common procedure. It's easy done. It's outpatient. It's about an hour to an hour and a half of surgery in the operating room. And it can have multiple types of anesthesia. It can be done under pure local, maybe a little bit of like Valium by mouth. Sometimes we do it under sedation, or for people who are very nervous, it can be done under general anesthesia, under care of anesthesiologist. The procedure involves correcting two issues with the ears. When you take a look at a patient with protruding ears, you find that they have what we call the cup of the ear is enlarged and it extends out. That's one part of the problem. But in some people, they're also missing what's called antihelical fold. This part of the ear here, that also gives shapes to it. Sometimes there is none and the ear really comes out. So the procedure involves making an incision in the back of the ear. We'll go ahead and tack the concha, which is the cup of the ear, back to keep it in position. Once that's done, we'll go ahead and recreate these folds, again coming from the back of the ear, placing some sutures to keep it in place. There are special measurements we do to make sure that the two sides are equal. And while doing this, now the ear goes back into position, so you no longer have to wear your hair. People tend to wear their hair to cover the ears so you can't see them. Recovery is relatively quick. Pain is minimal. Return to work is the next day or maybe 2 days later. But if you have any questions on that, please contact the office. We'll be happy to go over it with you. Well, enjoy the rest of the show. It's a little fun song. Thanks.